overall, how are we looking right now in North Texas and our hospitals? What's just the current state for our hospitals?
It's pretty serious. And by that, I mean, we've got about 2,000 COVID-19 patients throughout Trauma Service Area E, which is pretty much North Texas. And unfortunately, that's grown tremendously in the last 2 to 3 weeks.
How has the infrastructure and planning within our hospitals, how has it changed since that peak in July? And now we're, as you said, 94% of the way there. How are things looking a little different now?
I think the main thing is we've always had good planning for volume increases and even surge planning. But I think as we open back up COVID-19 units, we've learned a lot of lessons. I think the other thing, and this is a real tribute to the physicians and the clinicians and the respiratory therapists, frankly, we can probably use some of the drugs and medications and steroids and some of the things today that maybe we didn't have back in June and July and didn't understand.
A common argument that people will make is that hospitals are always at a certain capacity, no matter the time of the year. Is there any validity to that thought, or what are the flaws in that frame of mind that, well, hospitals are always at capacity?
There's a big flaw in that philosophy. Hospitals are not always at their capacity. Hospitals do plan for extended volume periods like influenza season, et cetera. But here's the issue. If you look at the infection rate and you look at the RT factor, you look at the R naught rate, we're at about 1.2 right now. You want that to be at 1 or below, or your infection rate is going to continue.
How does the areas around Dallas and Tarrant, the largest counties in our area, when these other counties are also hitting record highs, how does that impact Dallas and Tarrant County?
Yeah, it does impact it. And you're right. Grayson County, Ellis County, and Wise County have had increases related to COVID-19. Those counties do have some excellent hospitals, but the problem is they're rural areas. And as they fill up, some of those patients may have to migrate to the metropolitan area.
If Thanksgiving isn't handled correctly and safely, how could that impact our hospitals?
It means our third wave would grow enormously. And when you talk about Thanksgiving, and don't get me wrong, hospitals want the economy open, hospitals want schools open, but we've got to learn to coexist with this virus until that time comes. Make some short-term sacrifices for the long-term gain. Hopefully with the vaccine and it being distributed next Thanksgiving, you can have fun with your family and friends. But now we need to deal with the present. And the present is prevention, prevention, prevention.
Thank you for the time, Steve.
Stay safe.